Hey y'all, welcome to our YouTube channel. My name is Ansley and I'm an oncology nurse.
And my name is Luke and I'm a junior nursing student in the BSN program.
And we're brother and sister.
Yes, and today we're going to be talking about stress management techniques for stress in school nursing.
So, whenever I was in college, I was involved in a lot of things when I was in school. And so I was an RA, I was a cross country and track athlete, and then also a nursing student. So there was a lot of things that I had to juggle and a lot of things that caused stress. And so I had to learn what worked for me and what didn't work for me. And I had to have a lot of conversations with people who are mentoring me and leading me. And they would sit me down and say, hey, you need to incorporate these things to help you deal with your stress. And so I'm going to talk about some of those that helped me out.
And for me, it's going to be a little bit different because I'm still in school, but I made a lot of changes from the first 2 years to this year for dealing with stress because I was super booked my first 2 years, averaging like 20 credit hours of upper division classes all 4 semesters and trying to double major and double minor and get ready for med school and work 3 jobs and just little jobs though.
Little baby
jobs. And also do kind of 3 sports because
cross country and track. You're in season all year for cross country and track.
Cross country, indoor track, and outdoor track.
Yeah, so you don't get a break, and then you get like a 1 week break in the summer, and then that's it.
So I had to do a lot of learning between last year because I had like a complete physical, mental, emotional, everything breakdown, and then had to rebuild for this year. Yes. So I've incorporated a lot of those management techniques and it's made a huge difference for this semester.
So let's get into it. So the first couple things that we want to talk about are the things that we do every day, hopefully. Sleep, eat, and drink water.
So important, all of those. Eat nutrition because if not, you're going to be thinking wrong, you're going to be in brain fog.
Going to be run down.
Not going to have energy. Drink water, same reasons. You need to be hydrated. You need to be going to the bathroom regularly.
You need to fix your kidneys.
Yes, look at this shirt she just got me for Christmas. Oh. The kidneys aren't on here.
There's no kidneys on there, but...
Anyways, and then sleep is so important. You need a minimum of 7 to 8 hours of sleep. This is something that I was not good about last year. I think during school I averaged like 2 hours of sleep a night, and I really paid for it. And that's average. So like some nights I did get like 6 hours of sleep, which means I threw it off a lot. Anyways, that was not a good plan.
I don't even know.
Do not recommend. Yeah, so make sure you get sleep. Otherwise, it's going to cause problems. You can help with that by like having a regular sleep routine, getting up on time. And it's so important because you're going to be getting up early for clinicals, staying up late studying. Make sure that you prioritize and schedule in time for sleep. Sleep, eat, and drink water are top priorities.
Those are above studying and above.
If you have the option between studying a lot for a test or getting a minimum of 7 hours of sleep, go with the sleep. Because that's going to help you more than studying that last minute.
Because you're going to plan your time before that you will not be studying last minute. And that is our next point. So one thing that I did, especially my last 2 years of school, because I had so much going on, was I would sit down and plan out my life like 2 weeks at a time. And so I would say, okay, I have 2 hours on this day to study, 1 hour on this day to study, and I would block those out in my calendar actually. And then I would also write out what time practice was, because I had practice every morning at like 5 a.m. and then some days I had practice in the afternoon as well. So I would write those out, write out class times, write out break times, write out times that I would just be by myself for a little bit and really schedule it all out. And then, guess what? Everything fit.
Yeah.
Everything fit in my schedule.
I do the same thing, just not in a paper form. I do it on Google Calendar. And I just like type everything in there. I have like meal times blocked out, so I make sure I have scheduled time to eat. I have like scheduled time in to hang out with people or like to just sit in a social area where I know I'm going to see people that I know. Or I have time scheduled for exercise in there blocked out, or time for studying blocked out. I have tests reminders, homework reminders, everything in there so I can access it on my phone or my computer and it will notify me as well.
Yeah. So when you're planning out your week, you got to make sure to plan those times where you're not just doing school. Because even though nursing school is a lot and there's a lot going on and everyone builds it up to be something so crazy and hard, it doesn't have to be so crazy and hard. It is hard and there are crazy parts, but you need to have time where you're not just focusing on school, or else you're going to get burned out in school and then you're going to start your job burned out too.
And burnout is already a huge thing for nurses.
Yeah.
And you want to prevent that.
And practicing those techniques of building in that time of not just working on your work is going to help you whenever you actually start doing your job.
Yeah. Another thing you can build in is exercise, which is so important. You can do anywhere from walking to running, hiking, swimming, biking, lifting weights, working out with a group, stretching, doing yoga, Pilates, anything like that, martial arts, something like that.
Yeah.
Any one of those. I think that recommendation is 30 minutes of like moderate to strenuous exercise.
Yeah,
5 times a week is what is recommended.
By
the CDC or something.
WHO or
NIH,
whatever.
One of those
fancy
one of those organizations.
So and exercise is really important because it helps get your muscles moving. It helps your brain to think clearly. And it releases happy hormones.
Yes.
What you need to stay happy.
Yes, endorphins. And it will decrease your cortisol, which are your sad hormones. That's what happens hormones. When you get stressed. And so does sleep and everything. And also, when you're scheduling in the exercise, that'll also double as outside time if you're doing your workouts outside. Or it will double as friend time if you need more social time.
Yeah,
and that's another thing. Integrate those concepts. So if you can work out and work out and study at the same time. I've done that many times.
Me too.
Or like listening to a recorded lecture or reading over your notes if you're like on elliptical or something. Yeah. Or you can build together a social and exercise time, which we already said, or like nature time, which is a good stress management, just being out in nature. Or like try to integrate as many things as you can. If you can eat with people or study and eat sometimes.
Yeah, make the most use of your time.
Yeah.
Which you will need whenever you start nursing.
Right.
Because you'll need to be able to do multiple things at one time and plan out your day.
Yeah.
So this is really good practice.
Yeah. So you're going to be dealing with these hard things. And a couple of strategies you can use for dealing with them are like journaling. We both journal a lot. I like to write songs, and she likes to write
poetry.
Poems. You can express yourself with art or like coloring.
Music.
Those are fun. And really just like process all of the feelings that you have, and don't just push them down or push them outside or pretend like you don't have them because you're not a feely person.
Well, you have to deal with the stress. Everyone feels stress.
Yeah.
And you feel
stress
it in
is
different
normal.
ways. Yeah, and stress can be good too.
Yeah.
Because it can help you to function at a higher capacity, but you have to learn how to deal with the stress better than maybe you do right now. And we're all going to have ups and downs with dealing with stress. We both do, and everyone does. But if you incorporate some of these coping mechanisms like journaling or praying or just relaxing or getting out in nature.
Or talking to a counselor or a therapist.
Incorporate those things, and that will help you learn how to channel your stress, how to deal with your stress, and then you're better able to get things done and get more things accomplished, and you won't suffer so much for it.
Right. Okay, so let's say you are doing all of this, and then all of a sudden you're like in a almost panic-like situation, like you have a huge test that you didn't know about, or that you did know about, and it's just really big.
It's hard stuff.
Or you're at the hospital and something's happening.
Imbalance.
What can you do?
Well, this is what you can do. The stop technique.
Oh, yes. That one's my favorite.
Yes.
S stands for?
Stop.
Stop.
So whenever you feel yourself start to freak out, stop. Just stop.
If you notice those anxiety levels, like climbing, stop. And then T, take a breath.
This is my favorite one. Take a deep breath. This is what I do whenever I am at the hospital and I'm having a super stressful day, and maybe like a bunch of people are crashing that day and I have to be the nurse. I take a minute and I take a big deep breath, and I'm like, okay, Ainsley, you can do this. You're fine. Just breathe.
And you use some of that positive self-talk, and incorporate that, because that's a coping strategy they tell you in nursing school.
Yes.
And you can tell your patients too. Just like having a mantra, like I can do this, or this is easy, or I'm professional, or like my breaths are steady. Just any one of those that helps you like focus and calm down. You can also use like a 6-5-4 breathing technique where you breathe in for 6 counts, hold it for 5 at the top, and then breathe out for 4. I like that one. And
it's making me yawn.
Yeah. Okay. Then the O is for observe what's around you and ground yourself where you're at.
Yeah.
So you can.
So if you're really freaking out and your brain is just spiraling,
and you're like starting to get those physical reactions, like shaky hands or sweaty, or you're like,
then start noticing what's around you.
So that you can use the 5, 4, 3, 2, 1 technique.
Luke loves numbers.
I love numbers. Okay, so you do 5 things that you can see.
I can see 5 fingers.
Name those in your head. 4 things. No, not like that. 5 different things. It can be 4 things that you can hear.
I can.
3 things that you can feel.
Say what I can hear.
2 things that you can smell.
Smell.
And 1 thing that you can taste. So it's incorporating all of your 5 senses. Okay, and then the P is proceed with whatever is most important to you in that moment.
Yes.
Whether it's the task and you just really have to get the task done, such as saving a patient, or if you...
It's like prioritizing.
Yeah. Or if you need to prioritize sleep and take a nap, or prioritize eating. You haven't eaten in a while.
Yeah, say it's 3 o'clock in the afternoon and you haven't eaten. Well, the most important thing at that moment is for you to eat. Because you're not going to be able to function very well if you're trying to learn something, if you're trying to help patients, whatever, you need to eat, get that out of the way. So prioritize.
Exactly.
And then move on with the most important.
Yes. So that is all of the tips that we have, I think. And if we'll probably come up with more. If you have more, share them down below in the comment section.
And let us know if any of these tips help you.
Yes, and give us a like and comment and subscribe.
And no more stress.
Except for that's unrealistic, because everybody has stress.